Good morning to everyone. It's my great pleasure to welcome the eminent speakers and the delegates for this virtual voices to vitalize impact of pandemic in nursing research. We have with us the eminent speakers, Dr. Suresh K. Sharma, Mrs. Vijay Lakshmi, and Dr. Rebecca Sampson. At the outset, I thank the organizers and the eminent speakers for accepting and to be with us today. We'll start with the session, the impact of pandemic in nursing research. The COVID-19 is with us for the long haul, almost is going to be a 2 years, a marathon that we will run for months or years to come. We are not sure when it is going to end. So research in this time of pandemic, because we knew that research is indispensable for resolving the public health challenges according to WHO. So the COVID-19 pandemic has had a profound effect on the world. The research institutions have certainly felt its impact as well. Yet, while the coronavirus has brought many challenges to academic research, it has also created the opportunities for research to improve moving forward. The COVID-19 pandemic has placed a tremendous strain on sustaining the clinical research enterprise and will also likely affect the key study outcomes. These effects must be considered during the data analysis and interpretation. Nevertheless, the response to this pandemic have also introduced innovations that will advance the conduct of clinical research. So what is our institution responsibility and challenges as such when we see that COVID-19 research? How are we going to see that in a workplace, the health and safety, the social distancing, education and training, non-COVID-19 research, animal research and care, ongoing clinical research. These are the things which we need to see that. And as an investigator, how am I going to approach it? See the family, the COVID-19 research, on-site lab setting, and the research can be remotely, communication with the trainees and co-workers, planning and writing the grants, and maintaining the critical research and publications. So this is the one which we need to see that. So during this COVID-19, which poses a new institutional responsibilities and challenges, including the need to ensure the continuity of ongoing clinical research, increase COVID-19 related research, ensure the safety of employees and students, enforce the social distancing measures, ensure the continuing education of undergraduate and the graduate students, restrict the non-essential non-COVID-19 research activities, and maintain the required animal care resources. So a lot of challenges and opportunities are in front of us. So the investigators have employed multiple challenges to cope with the on-site lab restrictions. I request the delegates kindly mute your audio and get inside. And researchers have maintained the critical research activities, continue to submit their publications, balance the work and family responsibilities, initiated or collaborated on COVID-19 related research, ensure the limited on-site lab staffing, engage remote research opportunities, maintain a regular and frequent communication with trainees and co-workers, continue to plan and write research grants illustrated by Rachel. So how this COVID-19 affected research? We have with us today Dr. Rebecca and Vijay Lakshmi, who will be sharing their experiences. Few say that it's very little. I was already conducting research online. Then someone say that I moved all of my experiments to online. Others is 9%. Some say that I moved some of my experiments to online platforms and stopped others. Not at all. I'm not in a position to collect my data, 13%. Then I had to stop all my research, that is 16%. Then I do not do research, 6%. This is the survey which says about how during this period it's been affected. So the challenges which are faced during COVID-19, out of comfort zone always transition to the virtual platform. So during this pandemic, Researchers have moved out of their comfort zone to collect the data by telephone, by email, and through the electronic health record portal. So the connectivity, getting access to a strong enough internet connection to carry out the voice or video call is difficult. And the research project could divert travel funds to invest in improved internet connections for local researchers, research organizations, and the participants. The next C is the communication. So communicating through the voice calls or
Jayasudha, please unmute yourself.
the organizers have muted me, I think. They muted everyone.
Yes, they've muted everyone.
So the pandemic has kept the researchers from physical lab spaces, delaying the projects by months in some cases. And PPE and social distancing has added to the cost of research projects, forcing the institutions to make difficult choices. So increase in travel expenses due to lockdown. Cost of PPE also added extra cost to the research budget. A key source of income that many universities have relied on to help the support research has declined. What are the questions are raising here? The many charities have seen their donations drop off dramatically. The question is, will they be able to continue the funding research projects during this project? We have an eminent speaker with us who will be talking about these challenges and opportunities. So what are the opportunities in a nutshell? One big upside has been that public trust in science. Its important role in our society has increased. COVID vaccine is one such great example. This recognition should result in greater public investment in research in the years to come. So universities have become more open with each other and data are being shared for the public good, leading to a more collaborative way of thinking. The pandemic has brought a spirit of collaboration to the research institutions. So COVID-19 gives the institution a chance to reimagine what is possible moving forward. So the pandemic has prompted university leaders to rethink traditional structures and consider the new ways of doing the things that are better for everyone involved. So universities traditionally have been slow to change, but the pandemic showed that the rapid change is possible when the institutions feel a sense of urgency and there is no longer any excuse for the inaction. So before COVID, shifting everything online would have taken 2 years of the numerous committees. We were able to do it in 2 weeks. So capacity building is most important with the local partners so that they can take on more responsibility and lead research, not just during COVID-19, but also in the future. So the ethical issues, lockdowns and restrictions resulting from COVID-19 pandemic have produced a number of ethical challenges for research that should be considered carefully. Getting the consent from the study subjects, the research participants using the remote technologies can be a problematic when not able to obtain a physical signature or discuss the process face to face. To overcome this, consent forms could be sent, discussed and returned via email. Oral consent could be considered, particularly if it is possible to record it. This would need to be outlined during the ethical clearance process. About the setting, it has been found to blur the participants' understanding of the setting. This offers a rich data gathering opportunities. It also makes it more important to remind the participants that they are being interviewed or recorded. Some research participants surprisingly open during online interviews rather than in a more formal face-to-face setting. So the methodological issues, adopting the research methodologies in the COVID-19 pandemic is having innovative methods, using a methodology in a creative and dynamic manner that differs from the research currently available within the field. So where the terms which we have a computational modeling, creative research, data mining, data visualization, internet research, mobile methodologies, spatial analysis, text mining, video research, big data, how we are going to do that, collaborative research. So from there we have to see that. So with the internet research, we have to search all the content on internet. So in a broader way, we can say the innovative methods and qualitative data collection, and how from the narrow terms we come into the internet search. So validity of the collected data online seems to be one of the main problems. So APS fellow, Georgia State University, stated that fears occurring junk data, noted difficulty monitoring the participants' attention and engagement. And there are many studies that people have expressed that participants not taking the study seriously and getting the response that indicate that they are not paying attention to their study. So attention check failure rates have been at 30 to 50%, especially when trying to use the online research. So research which involves measuring the reaction times or require in-person methods such as eye tracking. Example, research which requires participants to exercise indoors or outdoors, both of which are clearly limited given the pandemic period. So ultimate COVID-19 mitigation and crisis resolution is dependent on high quality research aligned with top priority societal goals, which yields trustworthy data and actionable information. In addition, research should develop and evaluate the innovative strategies and technologies to improve access to care, management of health and disease, quality, safety, and cost effectiveness of care during pandemic could revolutionize the healthcare and healthcare system. So the pandemic gives us a chance to improve how we respond to the challenges going forward. So we have an opportunity to reset completely. That's very attractive. To conclude that the impact of COVID-19 pandemic on research and research in response to the pandemic highlights the importance of research, challenges of research and opportunities, and resource for making research more efficient and cost effective. So new paradigms and models for research will hopefully emerge from this pandemic. So we have an eminent speakers with us today who is going to deal about all this topic. And we have with us Professor Suresh K. Sharma, who is a professor and principal, College of Nursing, All India Institute of Medical Sciences, Jodhpur, Rajasthan. I'm sure everybody knows him, the whole India, not only in India, all over the world. You have been famous, sir. So we are really happy to have you with us today. And who is the President, Society of Perioperative Nursing, President, Society for Critical Care Nursing, and Secretary, Trainers Association of India, Uttarakhand branch. And he has completed his BSc Nursing from Rajiv Gandhi University of Health Sciences, Bangalore in 2000, MSc Medical Surgical Nursing from National Institute of Nursing Education, Chandigarh, and PhD from Department of Public Administration, Punjab University in Chandigarh in 2010. Who has been received Best Teacher Award, AIMS Rishikesh in 2018, has received the Florence Nightingale Award in 2001, and is a university first rank holder in BSc Nursing program in 2000. And is a member, Expert Advisory Committee, IT Infrastructure for Inter-Institute Networking and a Health Information System, working as a group member under National Coordination Center, Pharmacovigilance Program of India, Indian Pharmacopoeia Commission of Health and Family Welfare. He's a member special invitee, Expert Advisory Committee member for Nursing Education and Research for 6 new aims. So his publications are enormous. Textbooks, he has authored 11. Chapters authored is 45. And research papers published is 126. And he has received 35 funded research projects with the 94 dissertation he has guided. So he has a very vast knowledge in research. And he has authored a book also where every one of our students are referring that book, and the faculty also as a reference for taking your research classes. We are really happy to have you with us, Dr. Suresh K. Sharma. I welcome you. We have with us, the speaker is Vijay Lakshmi, who is a PhD scholar, Mansarovar Global University, Bhopal, Madhya Pradesh, who has completed her BSN from College of Nursing, Ramakrishna Institute of Paramedical Science, Coimbatore, her MSc Nursing from College of Nursing, Ramakrishna. She is pursuing her PhD in Nursing from January 2020 in Mansarovar Global University, Punjab, who has been a keynote speaker in the State Nursing Seminar at Aladhyarna College of Nursing, Tamil Nadu, India, and in first nursing conference, Innovation, Delegation, and Empowering Nurses, a trial for change at Al-Zori Hall at Kuwait, attended various webinars and publications on evidence-based nursing, flipped classroom methods, UG Arab student simulation experience with maternity simulites, clinical competence in ASCII, etc. She has presented the study on influence of balanced nutrition among 1 to 3 years children, primary healthcare conference in Dubai. She has presented a seminar on effective communication in CPN's areas. And she has worked in Oman for a period of more than 15 years, and she has come back to our India. Now we have with us Professor Dr. Rebecca Sampson, Director of Nursing and Research, Vinayaka Missions College of Nursing, Hospital, Puducherry. Ma'am is a lifetime member of TNI, NSS, NLCMA, ISPN, and many more. She has received a prestigious award, namely Best Citizen of India Award in 2015 from Dr. APJ Abdul Kalam, and she has received the gold medal. And she has received the National Florence Nightingale Award, Best Educationist Award in 2017, as well as Lifetime Achievement Award in 2016. And Madam has received her PhD in nursing in 2003 from Dr. MGR Medical University, Chennai. She is an active member of Core Committee for Development of Nursing Practice Act with the Ministry of Health and Family Welfare, Government of India. Ma'am is a peer team member for NAC, Academic Council, and expert member of Board of Nursing Service and Education. We are happy to have all the three eminent speakers with us today. Thank you all so much. And I leave this platform and invite Dr. Suresh K. Sharma to continue his session on challenges and opportunities in nursing research. Sir, the platform is yours. Thank you so much.
Thank you so much, Dr. Jayasudha, for your kind words and giving me opportunity to be on this podium today and speaking to young minds. And the topic which you have chosen is very important because COVID has disturbed everything. It's in common man's life or education, specifically nursing education or a research, either it's a biomedical research or nursing research. I will try to put my lights on how it has affected our lives. Give me a moment to share my slides and then I'll continue the presentation. Can you see my slides?
Yes, we could see.
Yes.
Perfect. So I think at outset, Dr. Jayasudha has highlighted that COVID-19 has affected the research and has brought up many challenges, but within the challenges, there had been few opportunities as well. If we look into the challenges of COVID-19, last year, postgraduate nursing students or doctoral nursing students were into fix how to collect the data now. We do not have those patients which we have thought to include as participants of our study. We do not have a opportunity to interact them face to face because either they are stuck up at their home or they cannot access the hospitals because hospitals are flooded with COVID-19 patients, or there is a fear of combating infections or encountering infections. So the patients were avoiding coming home and they were taking access of telemedicine and delaying the surgeries. In these situations, when the participants are not readily available in healthcare setting, and people were of fear of infection, so they were not allowing other people to meet because of the norms of social distancing. In these conditions, definitely we agree that there had been huge challenges for nurse researchers. But yes, we can't deny about opportunities. So if we look into the situation globally, COVID-19 pandemic has affected many aspects of our life, as I mentioned, including nursing education, both in developed and developing countries. No one has been spared by COVID-19. COVID-19 has profoundly changed the landscape of clinical nursing research and profile of research nurses in hospitals and healthcare services. COVID-19 has caused immense health and economic social damage. Any benefits it has brought to researchers have already come at far too high price for all of us. How many nursing research papers were published related to COVID-19 during last 6 months? If you look into online Google Scholar database, in that search between 1st January 2020 to 15th June 2020, there are 1,930 results combining search between the nursing COVID-19 and SARS-CoV-2. So we say that yes, publications targeted to nursing nurses and COVID-19, around 2,000 papers globally has published, and the number is small. That's not too big. Why do we need more nursing research? According to Pollitt, nurses have commitment to engage in it. List one role as a researcher, not only as a clinician or educationist or administrator, but out of the four important roles, the research role is also equally important. And there's a continuum of nursing practices. At one end, nurses are consumer for nursing research because they have to practice evidence-based practices. And at other end, they are producers of nursing research uh, because they have to generate the new evidences or refine the old practices so that our practices could be par excellence and best possible based in universe. So therefore, nurses and nursing requires research more than any other discipline, being the youngest discipline in the universe. In the line with available research data, frontline nurses need to be provided with latest evidence-based guidelines and practice during pandemic. And specifically donning, doffing PPE, swabbing techniques, airway management competencies, oxygen administration, use of ventilations, critical care uh, practices during COVID-19 where minimizing the risk of infections for the healthcare providers and other patients. So we require immediate data on these issues. So yes, nursing research was important. Cost-effective healthcare services to reduce the healthcare errors, improve healthcare quality, increase patient satisfaction. All these aspects have influenced the evidence-based practices, and based on nursing research, we required nursing research during COVID-19 more than any other time, and as rapid as possible, be it a vaccine development or be it providing a cost-effective, best possible care to our patients. Apparently, slow response to funding and research opportunities has been seen. And during this COVID-19 period, Dr. Jayashoda also highlighted this point. Disruption to education pipeline caused by COVID-19 because students were confined to their homes or their hostels, and schools, universities were closed down, and we were thinking for alternatives of doing education. The education in other disciplines may be possible, but education in health sciences, and particularly nursing sciences, where there is major hands-on happening into the live patient setting, that is the hospital wards and units. Those are the labs for our trainings were not accessible for students because of their risk of getting infections, and other than COVID patients, the number of patients declined in hospitals. Now, limitations on learning environment due to pandemic mitigations, measures such as the lockdown, social distancing, these has discouraged the nurses or nurse researchers or newly qualified people to engage into either education or research. 73% of ICN National Nursing Associations mentioned that education of student nurses was disrupted badly during pandemic, and this has delayed in graduation in many instances. Like Australia says that until unless the students goes to hospital, they complete these many hours of hands-on practice, then only they can be certified as a nurse, because we can't put our patients into risk by entering the half-cooked registered nurses, and they are today will be liable to provide unsafe care, and patient will be in risk, and they themselves will be risk because they misused. Now, let us highlight on challenges and opportunities. If I look into the challenges and opportunities, unforeseen financial and budgetary pressures have been seen by healthcare delivery system. Therefore, healthcare delivery system started thinking about cutting down the cost of other things which were not necessary at that particular time as per their opinion. For example, the research for nurses and clinical research. But some of the countries come in support with further publications and research without cost. So it was, win-win and lose-lose situations in certain instances. And we also have seen like more than 30 leading publishers globally have made their data freely accessible to PubMed Central and other repositories so that the people can make use of this knowledge and can make the health and healthcare available, which is of best quality. Now, let us look into other aspect that inevitable clinical crisis and unprecedented services and educational demands living services has put forth by the COVID-19, and there was no choice. But redeploy nurses from research role or teaching role to clinical role became more important in these situations, and that was a challenge. That was compromising research per se, and like doctoral students were asked to provide the patient care. Nurse educationists were asked to provide the patient care. Nurse researchers were asked to provide the patient care to meet the staff shortage because staff were continuously getting infected by COVID-19 and they were quarantined for that particular period. However, the deployment of PhD prepared nurses, scientists to work in clinical setting has definitely threatened the COVID-19 situation, but that also has given them opportunity to first-hand observe what research ideas they can take up to provide the immediate answer, and those have brought up few funding for them, and research was started growing to some extent there. Call for fast-tracked, sustained investment into nursing to strengthen the global response to COVID-19, increase the number of COVID-19 research studies. So this was an opportunity. However, fast track denotes seems to be explicitly advocate for funding more nurse researchers during this period because a priority was care, priority was drugs, priority was vaccine, not the nursing research or research or nursing interventions. The quality studies produced has been underlined as a critical as evident by the amount of those restricted during this period because funding was limited or rapid results were required. Every science has its own curve, and you can't generate something. If we take an example from nature, you require 9 months to develop a full baby. If you want to deliver it 5 months, it will be a disaster. So similarly, rapid results have derailed. And if you look from this example, globally, a clinical trial on hydroxychloroquine has shown us promising results in the initial level, but later on it was inconsistent and highlighting risk of, for the people who are consuming it, and then it was retracted back. This evidences has been retracted back and use has been banned. So it was a very challenging situation. If we look into the challenges, continuing disruption to educational pipeline caused by COVID-19 with limitations on learning environment due to pandemic mitigation, measures such as lockdown and social distancing resulted in shuttered or reduced the output of academic labs globally and slashed institutional budget and threatened availability of grants and other fellowships for the students who take up the research. And it discouraged the aspiring nursing candidates for further slow or interrupt in supply of newly qualified professionals. And researchers and PhD scholars have been forced to accumulate exclusive expertise on some research methodologies like virtual interviewing or systematic reviews and meta-analysis, thus lacking other essential competencies required for future scientists or nurse scientists. Other challenges like acute shortage of nurses and nursing faculty would limit the opportunities to expand training, education, and research capability due to few doctor-educated nurses available in country like India. Because there was a redeployment of nurses. It means that the research expertise in nursing was deleted at a crucial time of COVID-19 pandemic. Restricting even more the prospects for nurses to enroll into doctoral programs. Research scholars have left to halt studies or pause studies because patients were not available, or writing of manuscripts or funding applications due to redeployment or simply physical or emotional exhaustion to progress such outputs. Other challenges like local, national, or international structures do not enable, promote mobilization of nursing focused research teams, and unconscious tendency to default to command and control mode of nursing leadership and does not facilitate nursing research visibility anywhere. And specifically like country like India, where nursing and nursing research is not a priority, bedside nursing, yes, they have realized during COVID-19. Rapid modification in the type and scale of range of research opportunities allowed or approved in order to comply with pandemic measures may also foster a glut of studies in few overcrowded fields, which may hamper the progress of early career nurse researchers. Uh, Unfortunately, the quality and quantity of routine data available for research is likely to have been affected. As I have said, that there was de-escalation of documentation, there was less patients visiting hospitals, patients were delaying surgeries, patients were just focusing on telemedicine or teleconsultation, and other reasons, and nurses were workloaded, particularly into intensive care and COVID-19 care. Uh, According to Nature's first ever survey on postdoc worldwide, they found that 8 out of 10 postdoc researchers say that the global coronavirus pandemic has hampered their ability to conduct experiments or data collection. And more than half are finding it hard to discuss their research ideas, share their work with their supervisors and colleagues because they were in distant places. And nearly two-thirds believes that the pandemic has negatively affected their career prospects as a postdoc fellows. For researchers who are already dealing with limited funds, intense competition, and career uncertainties, this fallout become major concern during when they were pursuing their postdoc. Now, however, we can't deny about few opportunities which nurse researchers has experienced, like research in healthcare is witnessing an unprecedented expansion in knowledge and production. People started realizing that health is most important subject than anything else. Governments also started understanding, and then there was a few immediate fundings available, and this has given fast track system have ensured immediate publications of COVID-19 related studies. And in this context, researchers has been recognized as a key part of the government response, is so called as urgent public health research. The funding has been redirected and the process of ethical committees have been accelerated, enabling research protocols to be approved in a short period of time. Furthermore, many universities have been invited to conduct research or innovations related to coronavirus crisis, and this has given opportunity for nurses as well to fetch some fund or throw their ideas to draw some funds for their research studies. In addition, an unprecedented collaboration across disciplines, healthcare centers, countries has been established, overcoming traditional barriers such as that between nursing and medicine. And many publishers in developed countries supported the countries with online resources which were freely available, indirectly or directly contributing to emerging clinical paradigms by developing new research lines in this context. Now, to again highlight opportunity, many researchers attending in-person conferences has always been impractical due to caring commitment, financial constraint, personal circumstances. Now, virtual technology makes sectors more inclusive than ever. You can attend any international conference where you were no, it was not possible before COVID-19 because it was adding travel costs, stay cost, visa requirements, and so many things. But simultaneously, the researchers' travel restrictions and cancellation of conferences extends further limit prospects by internationalization, global collaboration, and mentorship. And the the face-to-face meeting always promotes the better collaboration and better linking with people that has diminished. A scoping review on nursing research during COVID-19 pandemic highlighted that only 21% articles were funded, those researches were conducted and published. Research about research focus, most of studies focused on psychological factors, but clinical practice studies were less. About collaboration, mainly the nurses conducted their research independently, that is more than 50%, and only 35% has been done in multidisciplinary team, while 35% of them were in collaboration with physicians. And but most of these studies were with academic affiliation, means educationists or academicians have conducted more than 70% of the study, and clinical nurses have conducted only closely 12% studies. Uh, Researchers' contribution must be assessed fairly. Building a better research culture means overhauling the way we think about reward and recognition. The pandemic has only made this clear. The metric used to assess researchers do not tell whole story of what and how they contribute. And with lockdown affecting researchers in so many different ways, we must be able to take individual circumstances into account. Founders need to work flexibly and be realistic about researchers can achieve. What is the way forward for all of us? The outbreak of pandemic has triggered huge changes in education at fast pace. And most of the educationists are sitting here listening this presentation. This area of research needs an urgent investigation of impact of these changes on effectiveness of e-learning student competences to care. So I was highlighting on this point that can we think now that classrooms are not required to large extent? I don't say they are not at all required, they are required, but we can use flipping of classes. We can do more of, remote learning for students. And then they come for some discussion, some enforcement, whereas more classes can be done in a virtual mode at different times. So student nurses can start spending their more time with preceptors in clinical area than spending more time in classrooms. So that we can produce more clinical practice ready nurses. And nurse academicians and educators and researchers need to look on how to take advantage of new technological solutions, which we have seen during COVID-19 pandemic, and challenges in transforming approaches of teaching and learning, and how we can make use of them in future to change the scenario, the way we education is done today. Studies regarding the increased use of telehealth and telenursing, the increased demand of healthcare personnel and impact on their morale and stress level also is recommended as a way forward. To conclude, the way we approach research in 2021 and beyond be forever marked by our experiences during COVID-19 pandemic. With researchers facing the same disruptions as many other sectors due to COVID-19, this focus has shown a new light on research culture rather than slipping back into old habits after COVID-19, making incremental changes into the way we are doing the things. We must use this opportunity to build on fundamentals of good research culture and reimagine the way we work. And not only the research, but education also must be transformed in the light of new technology which has emerged during COVID-19. Thank you so much for listening me patiently. These are the few references of my talk. That's all about it. Now I hand over back to the organizers for conducting the next session. Questions, I don't know whether it has to be taken up now or at the end of all three talks. Thank you so much for your patience here.
Thank you so much, Dr. Suresh K. Sharma. Till now, there were no questions. As the question arises, will it be possible for you to stay back, sir?
I have another meeting at 12 o'clock. So for next half an hour, I'll be here.
Okay.
And then I'll ask
any questions from the delegates, you can put it in chat box and he can clarify it.
Yeah, we can do with him first and then.
Yes, ma'am. So now I invite Dr. Rebecca Sampson, ma'am, for your presentation on ethical and methodological challenges in nursing research. Ma'am, the platform is yours.
I just want to share my screen.
Yes, ma'am.
Can you change? Yes, no. Yes.
We could see your slides, ma'am.
Okay.
Yes, ma'am.
Thank you for the opportunity. I don't know how much I can do, but hearing to Dr. Jayasudha and Dr. Sharma, it's excellent, and you have highlighted, I think, more than what is required. But now I'm here to share the practical aspects what we have experienced. I think that's what I thought we can share the challenges that we faced at the local level as an institution. Maybe I assume that it is common to all. So, or many at least. So welcome you all for this. Sorry, I'm not able to move. Okay. The topic given to refer presentation is introspection of methodological and ethical challenges faced during pandemic. So introspection, the title itself, looking into ourselves, what challenges we faced in carrying out the research, the general challenges and how to convert the challenges into opportunities at a global level, national level, and as academicians, all that is been shared. And it's been covered during the inaugural or keynote address. Now I'll try to do in a simple way. So this COVID-19 impact definitely has hampered the normal activities, normal proceedings, what we had been used to in carrying out research in different settings. Okay, this led to a unique opportunity to address the various research priorities that have been identified and pandemic containment and mitigation strategies such as movement restrictions, physical distancing, then social and economic disruptions also had a major impact on research activities across different settings. The scale of the challenge present for research, especially in resources, limited settings, could be significant and negatively has shown impact. The essential contribution of these settings to desperately needed for COVID-19 research. And researching in the age of COVID outlined how the pandemic has transformed the way to conduct research, has already been addressed. How to pivot the digital research methods has generated creativity and flexibility. So, as I said, from normal process, regular process, research process, it has been changed. It is a maybe 360-degree turn, we can say. We have created some different thoughts, provoked different thoughts, and made possible for identifying how to be flexible. Then how the digital divide has become more complex and new ethical dilemmas that have been posed by the pandemic. And in this presentation, we share, as I said, our experience in conducting this research. There are some ethical issues we faced. Technological divide. Number one, with the growing scientific technology, how this is being affecting in the gender population, and all strata. Okay, then interdisciplinary dialogue, data collection process, allocation of funds and resources, responsible conduct of science, okay, vulnerability, patient care, technology transfer and intellectual property resources, physical distancing versus social isolation, information versus misinformation, scientific knowledge and practices, then information access to both the researchers as well as for the patients or participants, their rights of handicap. So all these areas overall has been a big challenge and to be looked into as an ethical issues in carrying out the research. So, however, the pandemic has ensured these and another important research tool is the in-depth personal interview used in a qualitative research. The researchers who use such interviews have adopted during the pandemic by transitioning to telephonic and video conferencing, video interviews. As already it has been dealt with, telenursing practices. Okay, and not everyone is well versed with this. Even now, to log into for sharing of slides or participating in the online conferences or seminars is a big challenge for everyone with the technology. But you can imagine how this could be interfering with our research. So methodological challenges, coming to the actual point, starting with the study design. It's a big challenge. Whatever the IRC and IEC had given clearance before pandemic, and those who are in the middle of carrying out their research, the study design is mostly affected. Most of the experimental studies not able to carry out because of the randomized control trials were implemented widely, were tried to convert, to non-experimental designs. But this again, every step has to be reverted or looked into to come to, make it possible and flexible. There are the study designs. Then study setting is another challenge. Permission seeking difficulties. So getting permissions, for example, schools or any government officials with the lockdown, it was a real challenge because nursing studies are almost descriptive, non-experimental studies, so that the getting permissions became a big challenge. So government permissions obtained were not utilized in time. Okay, try to change the setting with the help of IEC again. Again, IEC calling them to attend another meeting and asking for the redesigning and taking a different setting is a big challenge. And that's again time consuming. Then population. Maybe school children were taken as a sample, that aggregate population. Then sample size. All that has become again another issue. Large coverage in institutions-based studies, but not with the public involved or out door-to-door survey. Client with the laboratory-based like a blood testing and all become a challenge because they are not able to travel because of lockdown. Then sample setting, sampling technique is a big challenge. Then tool practices, that is the practices that they rely on human interactions, including field visits and all, again is a problem. Then modified as an online survey, interviews through telephone. So how the challenges are trying to make it as an opportunity still go on in conducting the studies. Then data collection. During data collection, face-to-face data collection with the interview techniques and all not possible. So switch over to online, but looking for the convenience of the client availability, then networking conditions and non-use numbers. So lot of problems, but we can still try to contact them online, collect the data, because using the coding and decoding again is a problem, but we try to make that as a possible. The data processing, network availability, physical challenges, social distancing, no face-to-face discussion. So this only telephonic connectivity with the statistician, but completed in time than the usual period, as they were also work at home. So this was another opportunity, though in the pandemic situation, all started working from home because it was possible only with online. Then psychological challenges, every researcher, every PIs had stress and fear anxiety due to social changes. And we can imagine for anybody when they are in a regular process, when you give a little bit slight change, they get anxious, they become anxious because they're deviating from normal to or natural to unnatural situations. It's a again psychological trauma for both, especially for investigators. Then frequency of online conversation for data collection, but client time spending with us is a worry again. So whenever it is possible with the client only, we were able to collect the data, but not like on a set timings or even before to take their appointment and then call them, then collect the data online. But again, the generalizability or the validity of the data collected is a question. Stigma and withdrawal, then social isolation is another challenge. Here, opportunity to counseling the client is another to be created as an opportunity or turning into opportunities. Investigator safety, lack of PPEs. If suppose when the PIs are supposed to go to hospital and hospital-based studies, the main problem is lack of PPEs because we are not in the priority group. Researchers, because those who are giving direct patient care only was permitted, and non-availability of things has become a big challenge. So IRC, IEC monitored timely release of projects, information sheet, all that has been again changed, and then we have to make the members understand the challenges and then permit them to proceed with the studies. Participant safety, a symptomatic client hospital acquired infection is a big challenge. Information sheet and informed consent taken care, learned various standards including ICMR guidelines. Based on all this, modifying to fit into the situation was another opportunity created during pandemic. So changeover is a big challenge. Community related, most of the studies were survey type, biological waste generation during data collection was another challenge. Had a chance to look at into the hospital waste management and then proceed with the studies related. Then community related studies, lockdown and border restrictions played another role to prevent the spread, but it became an obstacle for the study. Again, digitalization, using digital mode. Contact tracing was another challenge. Researchers in most cases have little or no control over their survey because it was tracing the clients or research participants was big challenge. Then lockdown restrictions and government protocols interfered the deliverable purchases. Distancing and transmission issues have caused most non-COVID clinical research to be suspended, causing a reduction in recruitment of research participants and a delay in data entry into clinical trial base, but only on a tele-nursing measures. Then monitoring data collection was a big challenge. Then technical challenges, another big issue. We go back to status quo and learn from our Zoom modified experiments. Only time and more research we can tell how we can go about doing these studies. So shifting focus to patient care rather than the research, then giving up research to a greater or lesser extent to focus on a patient care, difficulty in investing time and energy in ongoing studies, unwillingness to take up a new studies, COVID or non-COVID related studies, fear and anxiety of themselves and contracting the disease, while treating the patients. Okay, constant protocol deviations, violations, and repeated communications with IEC. Then skeletal staff to handle studies due to lockdown, sick patients due to lockdown and inability of the patients to meet the investigator and to seek medical attention. Colleagues or dedicated research staff testing positive for the disease are not able to go further and proceed further. So methodological issues, challenges have become really big concern and hampered in carrying out the research studies what was planned and designed. Okay, so shifting the focus to COVID-19 pandemic care rather than the research. Need to do COVID-19 specific research in the face of mounting pressure for patient care, allocation and reallocation of the already scarce resources. Okay, low to middle income countries taking decisions on stopping research altogether because they are getting fed up and said, okay, we don't want to do. Then payment of research staff is another challenge. Laying of dedicated research staff is another thing. Employees testing positive is another challenge. Difficulty in traveling, risk of contact, need to travel as the study may be the only source of access to medication for the disease conditions. If the study entitles hospitalization, additional testing for COVID-19 prior to inpatient administration is a problem. Occurrence of COVID-19 while on research study, additional burden of disease, including quarantine, hospitalization, isolation, and even mortality. Caregiver burden due to the pandemic, anxiety, mental stress in the face of the pandemic, difficulty in accessing the university. So these are all, I believe, is common to all. Limited or no support staff due to lockdown. Need for modifications in SOPs. Inherent challenge of virtual meetings. Need to stay updated with the changes in IEC and regulatory guidance released by diverse agencies. Decision making to prioritize COVID studies. Pressure from investigators, administrators for rapid turnaround time. Difficulty in decision making due to uncertain risk benefits assessment of experimental medications. Okay, so we can go on and on with the, in short, the methodology and ethics are distinct elements of research. They are essential and are interwoven. Ethical challenges are common in clinical practice, and these are all to sum up with the process of obtaining informed consent was a big challenge. Okay, adaptability and decision making are key to the conducting ethical research in a crisis situation. So, because researcher must protect vulnerable participants and themselves. Many researchers have changed their methods, tools, and process to conduct their studies, modified, started new studies. Surveys are important to do, but again, they can't replace other research methods. So they were stuck. Since the COVID-19 outbreak, researchers have come up online survey data collection, trying to do their best. Process and protocols, once deemed to be, whatever is developed, it was difficult to change. Okay, permissions and authorizations, then other approvals are being expedited. As one research nurse observed, now we are getting information on a Monday. By Thursday, we are opening the study and recruiting patients. So patients, even in the global, many research studies have been done and facing the same challenges. And lessons learned, research nurses nurses will need to develop workable online or virtual alternatives. Consenting severely ill or mentally impaired patients was also a challenge. Should be thought of a different method, population settings, everything. And patient compensation to be taken care. Patients, healthcare workers, and study staff face significant psychological challenges and anxiety, which needed to be addressed. And clients needed orientation. Then comforts in home for online contacts led to better compliance, trust-winning conversation, the general discussions, basic ethical principles of no maleficence, beneficence, informed consent, autonomy, justice. All these are to keep up with these ethical issues were a challenge. Okay, so one is unprecedented situation likely to negatively impact the conduct of clinical research. Safety of participants and integrity of research is not to compromise. Then several challenges arise from the conduct of research during global health emergencies. They're like a scientific community to innovate solutions to standard research practices, which are difficult to meet. Now, coming to the big challenge, whatever we learn scientifically to do things in a flexible manner, the impact of COVID to change methodology as such, we have to show how to be done, how it has to be done. You go do this way, that way, and all will not help. Okay, so you become what you feed your mind. If you are scared, if you are withdrawn, if you develop a negative impact, we cannot be successful. But we have to face the challenges with the positivity. Okay, positivity and the dreams. How, with a creative mind, how best we can do with available resources in this pandemic crisis. Definitely, in a nutshell, shortage of staff, meeting of participants, research participants, also getting permissions from the setting, and funds, release of funds, and everything has become a big challenge. But still, we try to convert those challenges into opportunities. Okay, so I wanted to conclude this session, the methodological challenges to introspect and carry on with flexibility, how best you can do in spite of all these challenges. Thank you.
Thank you so much, ma'am, for sharing your knowledge and spreading your knowledge, whatever the practical experience which you had with our delegates. We have learned a lot today from you. Thank you so much, ma'am. And even though it was the last hour for you to come and present it, we really thanks a lot. Thank you so much.
Thank you. Definitely, I wish maybe I could have done a little more if I would have been.
Thank you.
I would have been given
so
opportunity more. Thank you anyway. I enjoyed being with you. Thank you very much.
Thank you so
I
much.
hope I was able to share.
Yes, ma'am. It was really good. Thank you so much, ma'am. And now invite Mrs. Vijayalakshmi. Ma'am, could you please stop sharing, ma'am?
Yes.
Mrs. Vijayalakshmi.
Yes, ma'am. I'm
the platform is yours, and I have seen her doing these activities in her during this pandemic with the patients in Tunisia. She has taught exercises for them, the coping strategies and all. So welcome you, Dr. Vijayalakshmi.
Thank you, ma'am.
Can't hear.
Can you hear, ma'am?
Yes, Dr. Vijayalakshmi.
First of all, good afternoon, good morning to everybody. Thank you so much for the opportunity provided, especially Dr. Jayasudha. Thank you so much. I'm so privileged to be in this platform. Talking about Jayasudha, Dr. Jayasudha, she was my senior. She's still our senior and doing very great things in the college to achieve to address many topics. And this itself is an evidence that people are getting a lot of information through online. Though we are calling ourselves as Corona is affecting things, but still we are getting info through such webinars. So thank you so much, Dr. Jayasudha, for providing this opportunity to be in your platform. And I take this opportunity to thank Dr. Suresh, Dr. Rebecca Sampson, and to be part of this. I'm so honored. Now, just to start, COVID itself has changed all possible ways that are almost familiar and that the way we do our normal activities. Like we have already come to an instance that we have to live with Corona, because everywhere we turn up, we see that only Corona is heard. We hear only news about Corona. Now, this lockdowns, restrictions, and high levels of uncertainty, everything has made us to live in this way itself. So we have already started to practice living in this world of Corona. Somebody said in the start of Corona that we should learn to live with Corona. So
Okay,
we are
sir.
living. We are living and we learned how to live. That itself is a big challenge that we are facing, and we made that as an opportunity itself. Now, in this situation, how do we carry out research that ensures the safety of participants and research? Is again a question. So what I felt is that for all researchers, the key elements to be considered to face ethical challenges all times, not only in Corona, in any time, it is like we have to increase the benefit and we have to minimize the risk, especially at this time where the whole world is facing this pandemic. We more concentrate on the benefits and we consider the risk to be more minimized. So this is what the two keywords or the key elements that all of us, being academicians, being educationists, being researchers, being clinicians, like we have a lot of phases. So any phase we are in, as nurses, any phase we are in, we should consider that the benefits must be more and the risk must be minimized. Now, coming to share my experience as a PhD scholar, I really wanted to say that I would thank Corona, though it has taken up a lot of lives, though we have lost many things, but still I would really say that I would thank Corona, because just to share a few experience of my career experience, like I was, as already Dr. Jayasudha has mentioned, I graduated in 1994. I did my post-graduation in 2000. Then I left the country in 2004 and I returned back to the country in 2020. Now, as soon as I came to India, there was lockdown in January. I came to India, and March the lockdown had started overall. So what I did is, what I thought, oh, now no way to work anywhere because everywhere things are going in a bad shape. So how can I make this as an opportunity? So I was longing to do my PhD program. So I just started to look into colleges where I can get into to do my PhD. And by the grace of God, luckily I got into the college, the University Manasarovar Global University, which is in Bhopal, Madhya Pradesh. I was hired there as a PhD scholar, and we have to take up the entrance exam. And though we had some difficulties through the lockdown, though it was during the lockdown period, but still they were just offering us the online way of giving us assignments and making us to be engaged, and we had the exams done. They said the exams will be in August, then it moved to September, then it moved to November, then finally we took up the exam by December. So this itself was creating us a lot of fear, anxiety, that whether we'll be able to do the study, whether we'll be able to continue the program itself. But then once we were, by October, the lockdown was a bit relaxed, and then the restrictions were relaxed, and we were given an opportunity to go to the university, to be there and to write the exam. So that was a great thing we achieved. In spite of these challenges we were meeting up, we were still able to go and do it. Then after that, they said by February, the RDC will be there. So we had to submit a copy of proposal. So we submitted the copy of proposal there. And then they said by February, we'll be called for RDC presentation. But then February went, March went, then again, the next lockdown had been started. So February went, March went, April went, and by June, they called us one fine morning. They said that day after tomorrow will be your RDC presentation. So again, the anxiety is stuck in with us, but somehow this online was a big platform which really helped us to put forward. Somebody said we have to go there, somebody said we have to do online. So all this was really making us too much of anxiety and stress, but luckily we were able to complete it. As Dr. Suresh and Ma'am Rebecca was mentioning, that though we had challenges put forward in front of us, but how it was turned as an opportunity is a great thing that I was able to forego that. I mean, I was able to move forward on that. So finally, I came up with a topic, and also I was searching through like what topic should I make up. Though we said like clinical topics are not possible, we cannot go up with other topics where we could reach the patients or the participants face to face. We cannot do this. So what I did, I started to research. I started to find out topics where I wanted wholesome participants, where they'll be willing to participate and they'll be really in need. Like it's my turn of taking up the doing up the study, and it's their turn of getting the benefits. So how could I do this? So I came up finally with a topic. I targeted my population as the teachers, and because of this COVID, online teaching was through and through all over the world as well in our country. So I just thought that let me focus on the school teachers. So I came with the topic of effect of integrated relaxation technique on anxiety and stress among school teachers conducting distance teaching, which is homeschooling, where I thought that I could just understand I could just assess their anxiety, stress level, and then I could give them some integrated relaxation techniques, which was the need of the hour, I thought. Like even Dr. Suresh was mentioning that a lot of psychological studies were more rather than the clinical studies itself. Yes, because everywhere, the whole world is just looking, they were like sitting as very anxious and fear of death. And how could I overcome the situation was the talk of the town. And so I thought that let me catch up that area so that at least some mental health promotions can be done. So that was this opportunity. I made it as an opportunity to come up with this topic, and my guide, Dr. Rashmi Sibi, who was very well supporting me. And though we were not able to talk face to face, but at least through online, through WhatsApp, through mail conversations, like I was able to get in touch with her, and she really helped me to guide things, and that's how I came up to this topic. Now, what are the barriers I do face during the data collection and ethical clearance? Yes, already Dr. Rebecca has clearly mentioned what were the challenges we're going through during data collection and all those things, but I have just put it in a nutshell that what was that I was going through. Like everywhere there was an uncertainty. To a greater extent, there was uncertainty in everything because of the restrictions. Like all means, like whether we have the college today, whether we'll be able to do the study, whether we'll be able to present, whether we'll be able to write the exam, whether the schools will be open, whether we'll be able to keep in touch, all those things were because of everyday restrictions now and then I was also like thinking, will they really accept me as a PhD scholar itself because of the things as I told before. Then completing the exams, approval of the topic, these were all our challenges, but still with whatever challenges we had, somehow or the other, the university themselves, the team themselves has made it as an opportunity for us to get it done. Then the permissions were getting delayed from the schools. And one more thing I would like to appreciate about the principals of the schools wherever I have got in with are, they were very, very welcoming. They were really telling that, oh, it's a great topic. And I think all our teachers right now need this because they are handling their household activities, they're handling the school activities, they are handling the online, and some of them are not digitally, they are not well versed in handling the online sessions even. So it's really a need for the hour, and you have really come to help us. So all the principals, by God's grace, everybody were welcoming me to do the study, and they said that they will create a platform. So though the permissions was getting delayed, and though the schools were not open per se, but still the principals were really helping me, and they were telling me that, ma'am, anytime you can come in and you can help us. And even the teachers, when I approached the teachers over the phone, now what was my methodology, what I followed was, normally data collection, we used to go with face-to-face, but here I was not able to do that because of, again, restrictions and isolation and things like that. So what I did, I just requested the principal that if they can create a WhatsApp group for me and give, so that I can pull up all the teachers. Now, my focus of teachers were primary school teachers and secondary school teachers. So what I did is I created WhatsApp group for primary teachers 1 to 5, and then 6 to 9, and then 10 and 10 to 12. Like 3 groups, 3 WhatsApp groups I have created, and all the discussions, all the queries, all the things that I was just doing through the WhatsApp for each group. And I fix every day, like Sunday will be for primary teachers, for Monday will be according to their time schedule of their classes. And I just agreed, we agreed upon how we can fix days for them. Like I target one school for 1 month. So 1 month I'll focus on for 50 to 70 participants, where I just divide my participants and I just have the WhatsApp group, and through the WhatsApp group was my interactions. So that made me really easy, and they were also very much they were also communicating with me in that way. Of course, I had inability to travel, but all these travel was just locked down because of the WhatsApp group and the media. I really thank the social media for that. Unavailability of samples. Initially, I did think that how I be able to overcome the samples, because some schools were, some schools were accepting, some teachers were not accepting. Some teachers were saying, I don't know how to use these kind of things like that. So it took a period of time for me to really help, to approach them and talk to them. And again, I was able to get those samples. Now, again, another barrier that we faced is sudden increase of COVID cases. We do not know. Today they say there is increase, tomorrow they say there is another increase of cases here and there. So that was also a barrier we faced. And of course, anxiety and stress throughout that was going on. All these were the barriers that we faced, or the challenges, and you could say that I faced during my data collection. Now, how do we overcome this, and what are the lessons we learned? Of course, I've started, though I made this as an opportunity, and it was my dream come true that I joined my PhD, so I have to complete it somehow. So how would I go through it? I just was going through some articles, and I was surprised that already this was given in the introduction slide itself. Like, I just took these 3 points, like how to minimize the exclusion, how to maximize the ethics, and how to overcome the practical situations or practical issues. These were the 3 things that while I kept on reading, how could I manage this? This was my thing. So everywhere now, technology has become the keyword everywhere. Now, thanks to the technology, every time we used to be telling that, oh, why are you always with the mobile? Why you use social media? Why you do this? Why you do that? But now that has come the helping area. So wherever technological area was possible, that I was trying to use that one. But only thing is, we have to see for a better internet coverage. That nowadays we have a lot of internet programs coming up also. So things are getting good. Now, use of secondary data. Now, how do I use this in my study was that some of the data that like to know the number of years, how many years the teachers were working. I did not go with asking many questions to the teachers themselves. I just got the help of the principal, and I just had a package of data with the from their register, and I was just able to, just one day I had an appointment with the principal. I just went to her and I collected the most of the informations from the principal, so that it was easy for me to get, so that unnecessary data, or I don't want to take more of their time from the teachers. So most of the things what I can get it from the school registers, I was able to get it like using the secondary data. Then designing my sample strategies, as I told you already, that I was just grouping my target population is 600. So how do I get 600 samples during this time? So what I did, I just surveyed the number of schools in and around Coimbatore, and I approached around 10 schools, and each school's approximately around 60 samples. I just choose them, and I categorized it as primary, secondary, and primary, secondary, and high secondary teachers, so that it was easy for me to group them in WhatsApp. Then use of community mobilizers. What I did here is like I choose one from the group. Like for example, I had 20 primary school teachers from one teacher who was very much willing and who was very much able to access to these digital things. I just asked her like, ma'am, can you help me to schedule things, and can you help me to coordinate with all the teachers, and can you just help them in any way that if they have any difficulty to do things, then she volunteered up. So I did have a great support from those teachers of their group itself, so which was really easy for me to get into with them. Now, maximizing ethics. How did I maximize my ethic? Of course, getting consent is one of the big thing there. Of course, permissions, all the school principals, they were really readily accepting because of the topic, and they wanted this help. So I didn't have any permission for that. An ethical committee clearance, I got it from my university. Now, consent from the participants that I was using, I used the Google Forms, and in Google Forms, there is a category where that I can ask them to verbally sign, to agree, or they are willing to participate in this. And also I took consent in the WhatsApp itself, like if they are really willing to participate. So that was not a big problem for me. And oral consent, some of them they sent voice note in the WhatsApp group. Some of them they just said, ma'am, I'm willing to participate. So I just considered that, and I have taken screenshots of all these. Other than the Google Forms, I have taken the screenshots of all those who have given information like this. Now, setting, of course, it's a purely an online research, but now mine is a quasi-experimental study. Now, what I was doing is like I uploaded the Google Forms in the WhatsApp group, and they were able to fill it up and send it back to me, and I started to analyze with that. Now, I have recorded a video about this integrated relaxation technique, which goes about 20 minutes. And I was just, I uploaded this video in the WhatsApp group, and they were just following it. They were just practicing it every day. And even the principal, she requested me that one day she will ask all the, group by group, she asked, they will come to the school. So we went one day to the school, and following all the social distancing and following all the PPE, we just made them, I just gave them the demonstration, and they were able to do that. So I was able to do both way. I did personally for them in the school, and also I uploaded the video in their WhatsApp group. So they were just doing it, and they said it's really beneficial for us. Now the risk, I think I was able to overcome the risk by major following the social protocols for the COVID prevention. Now, how to overcome the practical issues like contact? Yes, of course, every participant, they had their different levels of contact. Now, some they personally, they text me, they ask me, ma'am, should I do it 3 times per day? Though we give them all informations, though we teach them in person and also we upload, they still have queries. So I have to keep doing with them. I do have separate contacts with them also. So that way I am in contact with my samples. Connectivity, of course, nowadays the connectivity overall is good, and sometimes the principals tell me that, ma'am, if they are not able to do this, we can even call them to the schools, and then the schools have their good internet facilities. And of course, voice calls, video calls is just going on as usual. Communication, I was just following them, as I said to you. I'm just following them, sending them follow-ups, sending them continuous communication, and I hope I have built a good trust and relationship with them, so they are keeping the communication is really good with them. Of course, this is an additional workload. If it was another type of research, it was a traditional research that we just go do and come back and then do things. But here, every time I have to keep on reminding them, giving them some extra guidance if they really need. So all these things, it's an additional support, but with good team support and like to overcome the stress, we are just doing it. So this is how that I have gone through all my the data collection in terms of until now. Now I have completed 2 schools, so almost around 120 samples I've completed. I did have few difficulties in doing things, but by God's grace, overall with all these difficulties, I'm still yet going to complete, and I have learned many things from school 1 that which I was able to overcome in school 2. Now more in school 3, school 4, I'll be able to overcome. This is my overall strategy that I have planned up to do this. So
thank you,
just to,
Mrs.
Yes, ma'am.
Vijayalakshmi.
Yes, ma'am. Sorry, ma'am. So the overall lessons that we learned from COVID-19 is just like this, like how to coexist ourselves within the existing situation, how to cope up things, to cooperate, to have clear communications, etc. And let us be quite optimistic, objective, onset, onward. Now the word online has become a big thing for us during COVID. Now we value our lifetime and persons, as we know the life is very short. Isolate from ego, pride and selfishness, and distance from negative vibes, words and people. Now also I can still claim for digital assessment. So now the world has become digital also in terms of corona. So this is all that I would like to share. If anything that I've missed, can just ask me, I can just clarify things. Thank you so much, Dr. Jayasudha, again, and thank you so much.
Thank you so much, Mrs. Vijayalakshmi. This was a really live experience which you shared. I'm sure the delegates would have got the benefit out of it. It is the feelings and emotions what you have shared is how the difficult, it's not, which is not available either in the Google or book or any way. So that's what which we needed.
Thank you so much.
Thanks a lot for being with us today. Thank you so much.
Thank
and
you.
I wish
And
for
thank
your PhD.
Yeah, the organizers, thank you so much for inviting me on. Thank you. Thank you, ma'am.
Good afternoon to all. First and foremost, I thank our eminent speakers for this wonderful coverage on impact of pandemic in nursing research in various aspects, for not only sparing their valuable time with us to grace this webinar, but also enlightening us with your commendable deliberation. Thank you, ma'am. Special thanks to Dr. Suresh K. Sharma, Professor cum Principal, AIMS, Jodhpur, Rajasthan, for his efficient analysis on the topic challenges and opportunities in nursing research during this pandemic. The material presented was very pertinent to current research perspectives, such as effective e-learning on students' competence to care. Thank you, sir. Special thanks to Mrs. Vijayalakshmi, PhD scholar, Manasarovar Global University, Bhopal, Madhya Pradesh, and Professor Dr. Rebecca Sampson, Director of Nursing and Research, AVMCH Puducherry, for kindly donating their time and to share their valuable research experience on the topic introspections of methodological and ethical challenges faced during pandemic, which was well presented and contentful, and it was very informative content for the young investigators. Thank you, ma'am. Humble thanks to our principal, Dr. A. Jayasudha, for the dedicated stewardship, support, vision, and commitment in organizing this research webinar. Thank you, ma'am. I thank all our office admin members for who work behind the screen. Big thanks to all our participants. Thank you, one and all. Have a great day. Thank you.